So, to introduce you to Auriel, who we'll hand over to run today's session for us. We've worked with Auriel quite a bit recently on a couple of different sessions around diabetes. And today is looking at the relationship, obviously, between mental health and diabetes, but also how you can manage diabetes within your workplace as managers, but also for those who may have the disease, how you can live with it as well. So, I will hand you over. And like we say, do feel free to ask any questions or join in as much as you can.
Okay, thank you, Tracy. Appreciate that. And thank you, everybody, for your patience in waiting for the technical issues to be sorted this afternoon. So, good afternoon, everyone, and thank you for being here. When most people think about type 2 diabetes, they often think just about blood sugar, medication, and diet. And what they don't often see is the invisible mental load that comes with managing a lifelong condition. So, every day you've got employees with diabetes making hundreds of decisions about food, activity, medication, stress, sleep, and work as well. And if you add workplace pressures, deadlines, and long hours, and it is easy to see how diabetes and mental health become connected. So, stress and anxiety and depression and diabetes burnout don't just affect the individual's well-being, they can also impact concentration, productivity, attendance, and confidence at work. So today, what we're going to do is we're going to explore why this matters, what the signs you can look like, and how HR can create a workplace where people with diabetes don't just manage their condition, they can thrive. So I've lived with type 2 diabetes for 26 plus years, and it's given me some real world insight beyond the textbook and the policies. And I support organisations to create inclusive, diabetes friendly workplaces where employees can perform at their best. So, compliance and equality advisor by auditing workplaces, practices, facilitating meaningful conversations, and guiding organisations towards practical and inclusive solutions. And what I do is I work along HR managers and leadership teams to strengthen awareness, improve confidence, and support legal and best practice responsibilities. Now, my approach combines lived experience with professional expertise, helping businesses build healthier, more productive, and more inclusive workplaces. So by the end of the session, hopefully you'll be able to understand the relationship between diabetes and mental health. You'll be able to recognise why this matters to employers, HR professionals, and managers, and identify practical strategies to support employees living with diabetes, build confidence in creating a more inclusive, supportive, and legally compliant workforce. So let's have a look at the different types of diabetes. So diabetes, is a long-term condition that affects how the body regulates blood glucose, so blood sugar. And there's three main types. You've got type 1 diabetes, which is an autoimmune condition where the body produces little or no insulin. You've got type 2 diabetes, the body does not use insulin effectively or does not produce enough. So around 90% of diabetes cases are type 2. And you've also got just gestational diabetes, which develops during pregnancy and usually resolves itself after birth, but can increase future risk of type 2 diabetes. So the reality is diabetes management is a continuous 24 hours a day, 365 days a year maintenance. Now, much of that work is invisible. You've got things like monitoring blood glucose, planning meals, managing medication, exercise, stress, illness, and sleep as well. Now, there's 4.7 million people in the UK are living with diagnosed diabetes, and around 1.3 million people are estimated to have type 2 diabetes without actually knowing it. Now, one in five UK adults now live with either diabetes or pre-diabetes. Around 90 of people with diabetes have type 2. Diabetes is the most common in adults of working age, especially those between the ages of 40 and 64 age group. So, meaning a large proportion are in the working population. Type 2 diabetes is increasing in under 40s, and with nearly 170,000 plus cases in this age group in the UK alone. So if we break that down into simple data, if you've got a workforce of 100 people, that means 7 to 8 people will have diabetes. If you're in a workforce of 500 people, that means 35 to 40 people will have diabetes. So diabetes is more than a physical condition. It's a constant mental balancing act. So, every kind of things that you have to do on an every day-to-day basis, continuously monitoring and decision making, managing medication, food, hydration, and physical activity, planning ahead for meetings, travel, shift work, and unexpected changes, and living with the fear of complications, hypoglycemia, which is low blood sugar, and workplace stigma. Now, why should HR care about this? Well, 1 in 6 working people with diabetes say that they've experienced discrimination at work because of their condition. So many employees choose not to disclose their diabetes because they fear judgment or unfair treatment. Diabetes is often considered a disability under the Equality Act 2010, meaning that employers have a legal duty to consider reasonable adjustments and protect employees from discrimination. So the legal reminder here is these are not just upper limit uncapped compensation for successful claims. Unlawful discrimination under the Equality Act 2010, making proactive inclusion not the right thing to do, but obviously a sound business decision as well. So let's have a look at diabetes. Distress is an emotional burden, of living with and managing diabetes, and it is different from anxiety and depression. It is usually linked to everyday day demands of diabetes care, such as monitoring, medication, food choices, and fear of complications as well. Because it is less visible, it's often overlooked in the workplace until it shows up as an overwhelm, burnout, or reduced performance. So some of the common signs can include things like feeling overwhelmed by constant monitoring and decision making, worrying about blood glucose levels, complications, or low blood sugar, hyperglycemia, frustration with food, medication appointments, and lifestyle changing, feeling judged, isolated, or support not or unsupported at work. So losing motivation or feeling burnt out by the effort of managing diabetes every single day. And again, why should you care in HR? Well, diabetes distress can affect concentration, attendance, performance, and employees may hide the condition if they feel the fear of stigma or discrimination, and it can contribute to both absenteeism and presenteeism. So people may take time off when they are unwell or come to work while struggling, and performance perform below their usual level. So in a workplace health research, presenteeism is often estimated to be 2 to 3 times more costly than absenteeism and can amount to around 70% total of productivity loss linked to long-term conditions. So simple adjustments and a supportive culture can reduce stress and help people stay well at work. And again, just a legal reminder, diabetes is often considered as a disability under the Equality Act 2010, meaning employers have a legal duty to consider reasonable adjustments and protect employees from discrimination. If it's left until a crisis occurs, the company can be liable for an uncapped settlement fee along with damage to reputation as well. Now, we know diabetes and mental health influence each other every single day. So, mental health affects diabetes management, stress, anxiety, and low mood can make it harder to manage medication, nutrition, physical activity, and blood glucose monitoring. So, reduced motivation and decision fatigue can lead to missed routines and poorer self management. Diabetes affects mental health living with diabetes increases the risk of anxiety, depression, and diabetes distress. So, the constant responsibility of managing a lifelong condition can lead to emotional exhaustion and burnout. So, stress and blood glucose. And when we're stressed, the body releases hormones such as cortisol and adrenaline, which can raise blood sugar levels. So, blood glucose levels can also affect your mood, concentration, energy, and emotional well being, creating a cycle that is difficult sometimes to break. Supporting an employee's mental well-being can improve their diabetes management, and supporting their diabetes can improve their mental well-being, and they cannot be viewed as this in isolation. So the workplace can either support or undermine an employee's ability to manage diabetes and protect their mental well-being. Workplace challenges such as shift work and unpredictable schedules can make it harder to manage medication, meals, blood glucose levels, and sleep. High workloads can mean missed breaks, and workplace stress can negatively affect both mental well-being and diabetes management, and employees may feel uncomfortable disclosing their condition if they fear stigma or discrimination. The difference in managers make that manager aware and understanding can significantly improve an employee's experience at work. A simple conversation and reasonable adjustments can reduce stress, and it can also improve confidence and help employees perform at their best. Better support, better outcomes. And a workplace environment can make diabetes management easier or significantly harder. Simple adjustments can have a major impact on employees' well-being, performance, and also retention. So supporting employees with diabetes is not just about the right thing to do, it's also good for people performance and the organisation as well. So, the business case really is improve employees' well-being, engagement and retention, reduce sickness, absence, presenteeism and staff turnover, minimum legal, financial and reputational risks, and it creates an all-inclusive culture where employees feel safe to disclose long-term health conditions. So, what could this mean for your organisation? Well, as I said before, if you had a workforce of 100 employees, around 7 to 8 employees are likely to be living with diabetes, and around 15 to 20 employees may be living with pre-diabetes. And again, a workforce of 500 employees, around 35 to 40 employees are likely to be living with diabetes, and around 75 to 100 employees may be living with pre-diabetes. So again, the HR perspective on this is that every employee who feels supported is more likely to stay engaged and productive. So early intervention and reasonable adjustments can prevent problems escalating long-term absences, grievances, or discrimination claims. So disability discrimination claims under the Equality Act 2010 have no upper limit on compensation, making initiative taken support both a legal responsibility and a sound business investment. Now, the Equality Act 2010 provides important legal protection for many people living with diabetes, and what HR should know is that diabetes may meet the legal definition of a disability depending on its impact on the individual and taking account of the effects of their treatment. So employees have a duty to prevent discrimination, harassment and victimisation. Health information must be handled confidentiality and shared only on a need-to-know basis in line with data protection requirements. Now, managers should receive appropriate training so they can understand diabetes, know how to respond appropriately, and can support employees consistently. Employers should consider reasonable adjustments to remove barriers and enable employees to perform their role efficiently. So examples of reasonable adjustments could be, something like flexible break times for blood glucose testing, medication or meals, time off for diabetes-related medical appointments, flexibility around shift patterns where appropriate, a safe place to store medication and treat low blood sugar, and access to snacks, water and glucose monitoring equipment when needed. So a small adjustment can make a significant difference to the employee's health, well-being and performance while helping the organisation meet its legal obligations. So let's have a look at spotting the signs. So managers don't need to be clinicians, but they should know when an employee may need support. So the signs to look out for can be changes in mood, confidence, or concentration. So increased sickness, absence, lateness, or reduced productivity, withdrawal from colleagues, or declining in engagement, signs of stress, so fatigue or emotional overwhelm, notable changes in diabetes management, or where disclosed. And what managers can do is create a regular opportunity for supportive, confidential conversations. So listening without judgment and avoid making assumptions. A simple question to ask is what support would help you at work, and that just opens up the floor. It doesn't sort of pinpoint, oh, we know you've got diabetes. What's your problem? How can we help you? So signposting obviously employees to appropriate support and consider reasonable adjustments where needed. Remember, the goal is not to disclose a problem, is to recognise where someone may be struggling and create a workplace where they feel safe to ask for support. So, how can HR make a difference? Well, HR plays a key role in shaping a workplace where employees with diabetes feel supported, understood, and able to perform at their best. So, some key actions HR can take is review policies and procedures to ensure they are inclusive of long term conditions like diabetes, providing training for managers so that they understand diabetes, mental health, and reasonable adjustments, promote open, stigma-free conversations about health and well-being, build flexibility into ways of working where operationally possible, and to support health needs and performance. Encourage early disclosure by creating a culture of trust and psychological safety. And how I can support this as a diabetes advisor is as a diabetes equality compliance advisor. What I do is I do support organisations with their awareness into practical actions by auditing workplace policies, procedures and practices through an inclusion and compliance lens, supporting HR teams and managers to understand diabetes in real-world workplace contexts, facilitating training sessions that build confidence in having a supportive conversation, helping organisations implement reasonable adjustments that are practical, fair and sustainable. So acting as a guide between the lived experience and the workplace policy, ensuring support in both compliant and generally effective. The outcome is HR teams gain confidence, managers feel equipped and employees feel supported, leading to a healthier, more productive and more inclusive workplace. So supportive conversations don't need to be complex. Small constant check-ins can make a significant difference. So again, kind of things like helpful conversation starters, what support would help you manage your condition at work? Are there any adjustments that would make things easier for you? How can we support you during busy or more stressful periods? And is there anything of work that feels like a barrier right now? So again, employees are not legally required to disclose a diabetes diagnosis unless this is necessary for their job. So employees can choose to disclose diabetes if it helps them get support. Any information shared, as you know, must stay strictly confidential and be used only to enable adjustments and not medical scrutiny. However, where employees do choose to share, early and open discussions can be extremely helpful in ensuring the right support is in place and reducing risk for both the individual and the organisation. Now, if you do create a culture where people do feel safe to talk about health, it's more effective than relying on a formal disclosure process. So, practical approach to supporting disclosure, one effective approach is to introduce an open door health and support clinic day where employees can have an informal, confidential conversation about any health conditions or supports they may need. How I can support this process as a diabetes equality and a compliance advisor, I can facilitate these clinic style sessions with employees and managers, provide on the spot guidance on reasonable adjustments, complete and sign off documentation during the session, ensuring paperwork is finalised immediately, and reduce administration burden for HR by ensuring information is captured accurately and securely at the point of conversation. So the outcome here is less paperwork chasing for HR, quicker support for employees, and a more initiative taken in supportive workplace culture. So if we have a look at some of the key takeaways then. So number one, we know diabetes and mental health are connected. Diabetes is not just a physical condition. It carries significant emotional and physical load, and mental health directly impacts diabetes management and well-being. Two, supporting employees benefit both people and organisation. And again, when employees feel supported, they are more likely to be engaged, productive, and present. Good support reduces absence, improves retention, and lowers the risk of burnout, stress-related illness, and performance issues. And three, creating informed, flexible, and inclusive workplaces matter. So small practical adjustments combined with manager awareness and open communication can make a significant difference. Inclusion does not require a complex system, but it does require understanding and consistency. So if the workplace don't get this right, the risks are a disability discrimination claim under the Equality Act 2010 that has no upper compensation limit. Over 50% of tribunal cases do involve discrimination claims. Presenteeism can cost 2 to 3 times more than sickness absence. Estimated financial exposure can be 100 employees, that's 15 to 50,000 plus annual productivity loss, absence and presenteeism and disengagement. If you've got a workforce of 500 employees, that's up to 75,000 to 250 plus thousand annual productivity loss. So cost increases significantly when unmanaged long-term conditions lead to stress, absence, and turnover. So if the workplace does get it right, though, what are your rewards? So it's reduced absenteeism, turnover and HR intervention costs, lower legal exposure, fewer tribunal risks, improved productivity and engagement across teams. So the potential savings could be even a 10 to 20% improvement in support and reduction can save for 100 employees, say 15 to 40 plus thousand annually, and for 500 employees, 75 to 200 plus annually. So how can I support you? So as a diabetes equality and compliance advisor, what I do is I support organisations to bridge the gap between policy and practice by reviewing policies through an inclusion and compliance lens, training managers to have confident, supportive conversation, supporting HR teams to improve reasonable adjustments effectively, running practical workplace sessions and open clinic style support days, and reduce HR workload by streamlining documentation and support processes. So the bottom line is that poor support costs money and good support saves money. So as a general HR best practices, workplace policies should be formally reviewed at least once every 12 months, have a light review plus a deep or biannual review as well. Refresh diabetes policy should be set, not be set and forgot. It should be a living system that keeps pace with real life employees' needs and legal expectations. Okay, so thank you very much for all your time and effort in listening to me drone on for a few moments about diabetes and mental health. So I hope the session has been helpful and it's helped you to understand the connection between diabetes and mental health and the importance role of HR plays in creating supportive, inclusive workplaces. If you would like to explore this further, I can offer a free 20-minute conversation to discuss it. Your current workplace challenges where support for employees with diabetes may be needed, practical, realistic next steps to your organisation. And this is an informal chat just to see where I can support you and your team in a meaningful way. So together we can turn awareness into action. So I'll open it up. I'll stop talking now and I'll open it up to the floor in case there's any questions you would like to ask.
Thanks, Auriel. That's really useful. As Auriel said, if anybody's got any questions, feel free to pop your mics on or put them in the chat. We did have a couple of questions that were emailed in advance, if we could just ask you to cover. So the first question was, in terms of type 1 and type 2, what physical differences should managers or HR teams expect to see between staff that are diagnosed with either type, or is the management the same for both of them?
The management for the same as the both of them. The only thing you may find for type 1, because they're mainly they're monitored by insulin, they might have a higher risk of hypoglycemia, so low blood sugar. And for type 2, The likelihood of hypoglycemia is a lot less, but it can still happen. But with type 2, a lot more, maybe higher sugar levels. So there's a slight difference, but the management is still the same for both, whether it's a type 1 or type 2.
Brilliant, thank you. And that leads on to the next question. So somebody else had asked if you've got somebody in the team or somebody in your team that has declared that they're diagnosed with diabetes, but they don't want to accept any support, they don't want risk assessments, they don't want to discuss it at all in the workplace. Any tips that you would give to that manager to support the person if they're not accepting the support?
Okay, well, the only thing you can do is you could go up to them and say, "How are you today? How you feeling? How you getting on?" Just a general question. And you might want to make a note in the HR file that you have sort of like asked them, if they need any help or support, and they said no, they're okay. In case anything comes back onto you in the future, that's the one way you can protect yourself and protect the employee as well. Just making sure, that they don't look like they're absolutely, you're not putting too much deadlines on them, pressures and things like that, or they may look or feel as though they're being overworked or feel overwhelmed.
Yeah, absolutely. It's a really good tip. It's all about documentation, isn't it? And we're saying to people, make return to work interviews normal after any
That
absence,
that's
even if it's
it.
only a
Yeah. So
day, or give people the chance to talk, isn't it?
yeah, they could say, yeah, I've just been put on some new medication. I'm just trying to sort out, my eating patterns and things like that. So it can have an effect. So yeah, it's just having those open door policies so that they know, but they don't want to accept any help, but making a note on their file. So if anything does happen,
Yeah.
it doesn't come back on your head.
Okay, brilliant. There's no other questions in the chat. Are we okay to stop the recording?